Hi, thank you. 6:29 this morning, 239 scientists signed a letter addressing to the World Health Organization, asking them to be more upfront in explaining how COVID-19 transmits, possibly in the air. Now the WHO has acknowledged emerging evidence that indicates that's possible.
So this morning, we are once again joined live with Dr. Dana Hawkinson from the University of Kansas Health System. As always, doctor, thank you so much for joining us. We really do appreciate it.
Yeah, hi, thank you.
Now, doctor, the World Health Organization has said COVID-19 is spread through droplets. So can you explain how that form of transmission is different from airborne?
Yeah, absolutely. I think this is a very key point. There is a lot of details and in getting into the weeds for this. We've addressed this on our show, and actually yesterday we even addressed it with some of our physicians and providers, and it was our pulmonary doctors, our infectious disease doctors, and our internal medicine doctors, because they had a concern because of that letter. Certainly, when we think of airborne infection, the most common airborne infections we think about are tuberculosis, which is a bacteria, and measles, which is a virus. And both of those are extremely contagious, certainly measles more than tuberculosis. But those particles, those viral particles, really do seem to hang in the air and can hang in a room for up to 2 hours or more. So it's extremely dangerous when we have somebody that comes through the hospital who has measles, because then we have to do a lot of contact tracing and investigation. For COVID-19, we still believe it's droplets, but how big are those droplets? You know, typically we've said mostly typical droplets will drop at 3, 6, 10, 8 feet out. And continue to drop and continue to disperse and get in less concentrations at that point. We still continue to believe it is droplet, but the concern is, well, how big are those droplets that you are coughing out, or talking, or laughing, and expelling virus in those droplets, and how long can they hang in the air? So really the classical term of airborne is not the same for this virus, for COVID-19. It is still on droplets, but the real concern is how much of those droplets are continuing to be out in the environment. How much do those smaller droplets disperse? It really continues to not change much of what we're doing. And this is evidenced by all of the healthcare workers that aren't even wearing N95 masks, but are just wearing simple surgical masks, as well as the population data, which shows countries that mandate mask use have a decrease in their infection rate and have a decrease thereby in their mortality rate as well. So it continues to be a droplet spread, but it's just a matter of semantics, is how much are we talking about, how small those droplets are, and how long are they hanging in the air, and things of that nature. But it certainly, at this point, doesn't seem to be airborne as you think of typical airborne, like tuberculosis or measles.
Very scary thought, right? That's a little comforting to hear. Doctor, a new survey from the Centers for Disease Control found that 54% of people who tested positive for COVID-19 couldn't pinpoint how they contracted the virus. So how does knowing where you got it make it easier on doctors to treat the virus?
Yeah, it doesn't make it easier to treat individually per se, but certainly for contact tracing, it's extremely important, because we know that contact tracing is one of the pillars that we're looking at in the public health realm to help decrease the spread. The other issue is your individual exposure. So certainly, you know, keeping track of where you've been is important, but we have to remember that exposure has really been defined as time multiplied by proximity to any one person. And so that's important when you go out to remember that. Certainly, you know, for personally, it's important when I'm doing things. Again, I still haven't been out to a restaurant, although a lot of people continue to go out to restaurants and bars. In those cases, it's important to understand, how close am I to other people? How long have I been around other people? If you're doing things outdoors, it's a lot easier to space and stay in that further distance, more than 6 feet, 8 feet, or 10 feet. And again, reducing the time as well. So from a contact tracing aspect, it is very important, and certainly keeping a journal is probably not an unreasonable thing to do, but it does make it more difficult if you don't know when or where you were exposed.
And doctor, we want to talk to you a little bit about masks. You know, retailers are selling masks now with zippers, so you can zip and unzip them when you want to eat or drink. So let's say I'm out in the store and I want to take a drink. Is it safer or less safe for me to unzip my mask when I take a sip when I'm shopping?
Yeah, unfortunately, I don't know that there's going to be any head-to-head trials of masks with zippers or openings compared to not. I think the first thing we want to do is really get everybody wearing a mask. If the mask has a zipper on it, that's fine. Let's deal with that later. Let's get the mask culture going, get people wearing a mask. At that point, as you had talked about before, it is vitally important. We have always talked about not manipulating the mask, not contaminating the mask. I guess if there's a zipper on it and you're not touching the mask exactly, that may be reasonable. But I think the main thing here is let's change the culture. Let's get people in masks. If people want to have a zipper to eat or drink, let's deal with that later. Let's start with the mask. It may be a reasonable thing to do. I think we just got to kind of continue to take it one day at a time. Let's start getting people in masks first and then deal with that later. If it's easier for them and I'm going to only wear a mask with a zipper, I would certainly applaud that. But, I think the first thing is getting people in masks.
I think we might start to see more of those, especially now that the advice is even when you go to the restaurant, you wear the mask at the table until you're eating or drinking. So it's a lot of people wondering if that's going to make a difference.
Yep.
Interesting. Dr. Hawkinson, thank you so much for joining us this morning.
Thank you so much.